Welcome back from that short break. Now we head into our expert discussion. Now this is your health show where we bring you conversations that matter, and today we are going to discuss a very special topic that is surrounded by a lot of myths, pressure, and unanswered questions, and this is fertility. So every person has the way they may call it. We can say fertility clock, a biological timeline that influences the ability to conceive. But what exactly does it mean? Does age determine fertility completely? When does someone start thinking about their reproductive health, and what factors can speed up or slow down this clock? So today we are going to separate the facts from the myths and understand how age, lifestyle, health condition, and early medical attention can influence this fertility. Joining us in this discussion is a very special guest, and she is a gynecologist and also a medical director at a health facility called Midland Healthcare. And this is none other than Dr. Elena Nachintu.
Nice meeting you.
Nice meeting you. Thank
and
you
I'm glad to be here.
Yeah. How was your journey coming here?
It was good.
Okay.
It was good, yes.
Even the week is ending. How can you say your week was like from where it started?
Interesting. My days are usually busy, mainly with working with women, couples. So it's quite busy.
How about at the facility, Midland Healthcare? How are people there?
Midland Healthcare is good. Okay. I must say it's relatively busy, though we handle a wide scope of services.
Okay.
We have a very busy outpatient department. Yeah. We have a very busy gyne clinic, pediatric, and other specialties. Yeah. So we are trusted mainly by the community, but we also have clients who come from far. Okay. So we engage in all scopes. We have an operating theater, dental, so we have a wide scope of services at Midland.
Okay. Yeah. So today we discuss the fertility clock. Yep. So doctor, when we talk about fertility clock, what exactly are we referring to?
First and foremost, I want to tell our viewers out there, when we talk about fertility clock, it's not something that should scare. Okay. Yeah,
people when they hear fertility clock, like they get scared because like it is. I think people like being fertile.
Yes.
Let me guess. So when they hear fertility clock, it's something that scares. Yeah.
But it's not something that should scare us. It's something that should be. It's an empowerment of information, okay, to help us make informed decisions. So when we talk about fertility clock, and also it doesn't only apply to the females. Okay. You know, society has put a lot of load on us. Yeah. Every burden tends to point to the female side. So when we talk about fertility clock, it's not only on the side of the female, but also on the side of the male. But it's something that should help the young generation, I must say, to get empowered with information, to make sure they make the right choices at the right time, to listen to your body, because since it's a clock, actually the best way to form, it's like a battery. Okay. Because a clock just goes and stops, and it's now 6, it's now, yes, that can happen. But you know, a battery phases out slowly by slowly. It gets old. So for a woman, as soon as you're born, the eggs start aging. Yeah, sure. Same applies to the men. Yeah. Okay. A little bit slower, I must say, but overall, that is what we can say is a fertility clock. Okay. So doctor, on that same note, at what age does this fertility generally begin to change, and why does it happen? Okay, for a woman, we are born with around 1 million to 2 million eggs. But as soon as you're born, that's when you start losing them. Okay, they die, and every month with babies. Yes. Okay. So every month, with every ovulation, we have one dominant egg that comes out that has been ovulated. But then you have another 1,000 that die. Okay. That die off. So you can imagine you're losing every month. So that means that by the time you are 40, the egg that you have is 40 years old.
Is there even a specific number that in a female's body there this amount of eggs? Because like if you say that every month there is an egg that dies, then how many are those? Because in a year there are 365 days. So if you had to sum up, how many are those? Does the body like produce these eggs like every time like there is something new like there is a new production for eggs, or it's just there is that bunch of eggs that are there?
So unfortunately, unlike the males who produce sperms daily, eggs are not produced daily.
Okay.
So we are born with them. So the eggs you're born with are the ones that take you all the way.
Okay.
So the peak of fertility, I must say, is 20 to 25,
Okay.
20 to 25 years. And then it keeps declining with time. So it declines from around, most people think 35 is the time that they should now start getting aware.
Okay.
But times have changed.
Yeah.
By the time you are 30 years old, I have told you that egg is 30 years old, okay? So when we talk about fertility, we talk about the quantity, but also the quality.
Yeah.
And most women and men spend a lot of time, we go to the gym, we eat well, take all those supplements, and I want you to understand that it is very good to keep your body fit. But when someone comes to the fertility clinic and we take notes, I'm not going to look at how many fruits, how many times you go to the gym. Number one is age. Number one is age, because you cannot beat age, and that is something we have failed to beat in the fertility clinic. You are not beat age. So as you grow 30, they are declining in quality, okay, and of course quantity, because it's wear and tear. Okay. If you look at how the ovary and the egg is formed, there's a lot of machinery inside there, inside the egg, a lot of machinery that enables it to do its work. So by the time you hit 35, you are declining really. Then 40, it is markedly decline. There's a difference between someone who is 32 and someone who is 35. Yes, in the quality of eggs and also the quantity.
Okay, so doctor, on that same note, why do you think that age is such an important factor when it comes to the female fertility?
Now, age is very important. Why? Because just what I just said, because the egg quality keeps reducing and the quantity also. And then also as we grow, and this is something that most people may not realize. So for the medics out there should know that infertility for a woman tells you a lot about your overall health. And that is when we bring out the issue of polycystic ovaries, or PMO as the name changed. So it just tells you a lot about the overall health. So it's not that so I am struggling to conceive, so when I have conceived I'm fine. Statistics show even in the later years you have struggled to conceive, you have polycystic ovaries, you're prone to getting diabetes. You are probably moving with yes, you have type 2 diabetes. You are prone to getting cardiac disease in the perimenopause. So it gives you an overall picture of the health of the woman.
So many people actually believe that I can have a baby whenever I want because like I'm still young. Is that or is true?
No, it's not true. And I see this many times when someone comes to the hospital and they say, well, doctor, I've been trying for 2 years, but my periods are normal. So people tend to think that since the periods are normal, I am obviously ovulating and I can have a child when I want. But that's not the case. You can still have your periods when you're not ovulating, or the quality of the egg is not the one that we need. But also getting back to the male side, when they hit 40, 45, the quality also goes low. You find that, well, even if you make a young lady pregnant, there's a higher risk of miscarriage because DNA fragment, I don't know if this language is DNA fragmentation, the quality of the sperm also, that DNA fragments, you know, they're aging, they forget which chromosome has to be where.
Okay.
So you find that either increased rate of miscarriages, increased rate of congenital anomalies as they grow, but also the energy of the sperm to swim. So everything happens on the side of the male and on the side of the female, and males are close to 40 to 50% responsible for infertility. And this is what I was saying. Most of the load is put on the female, but males have 40 to 50% responsible for infertility in a couple.
So it's highly important to look at a male's fertility before they like judge a woman's.
When they come to the clinic, who is your spouse? We need semen. And semen analysis is one of the most interesting things that will tell, because it has parameters that you see, starting from the time it liquefies, starting from also the volume, how it appears, but also the anatomy, the shape of the sperm itself. It must have energy, it must have a head, it must have a strong tail. So you can find that some people have maybe, and the number also. So God made it in a way that there's a particular number of sperms that has to be deposited. Okay. So some have 2 heads, so some have 2 tails, some are lame, they cannot swim. Okay. So semen analysis is very important. Some have bacteria also, or they are infected. They have to be treated. Okay, doctor, is there a difference between being able to get pregnant and having a healthy pregnancy as someone gets older? Come again? Is there a difference between being able to get pregnant and having a healthy pregnancy as someone gets older? Yes, I like that question. Now, one thing our viewers have to understand is that conception is a communication. And I want us to look at the brain as a central command center. So we have our central command center, which reads the signals from the ovaries. So it cannot see what's happening in the ovaries, so it relies entirely on the signals that are coming from the ovaries. So it sends signals, then the ovary communicates to the brain. Now here is a time where the quality of the ovaries has gone down. Okay, the quantity has also reduced. So the brain will start misinterpreting these signals. Or the signals take a longer time to reach wherever they are going, and that is age related. So a time comes where even when you conceive, there's a higher risk of miscarriage, higher risk of congenital anomalies, and this is what we tell people at the fertility clinic. So age has an important factor because of that communication from the brain. It's not all about, some people think conception is ovary, enseke, and then the uterus. You must have a brain that will read the signal. Yes. Also, about the men's fertility, what are some of the lifestyle habits that can reduce their fertility? So for the men, like I said before, the fragmentation of the DNA. So the risks are smoking, alcohol, chemotherapy, of course radiation, heat, age, and yes, and a number of other medications, especially in chemotherapy. There are a number of medications that will affect. But also heat. People don't forget the heat. The beauty is with the male. What do you mean by the heat? The heat is all about because the production is outside the body. So if the temperature is above the temperature that should favor production, then you will not have good quality. The good thing with the male is that most of those things are reversible. Some are not reversible, because sometimes we have seen males who cannot, who by the time you have a semen analysis, maybe they have oligozoospermia or asthenospermia, the chances of them fathering a child are really slim. And that goes back to maybe they were sick, or maybe that's their nature. So that is also another aspect in the male. Yes. Also, doctor, can someone look healthy, very healthy, but still have fertility problems? Yes, that's a very good question, by the way. And we see this many times. Someone will come, and the most important thing is that women think that having a normal period I can't.
That's okay.
Yes.
Yeah.
And then there's also another thing that is disturbing us. Women come in the clinic with the fertility apps, these apps that we have.
Yeah,
they're monitoring.
of course, there are many nowadays. Like everyone looks.
Everyone has, so that they are monitoring the time of ovulation, so that they can conceive. Now, I have some bad news for you. If you go deeper in the cycle, I know why you're smiling. If you go deeper into the science, we have two phases in the cycle. Yeah. The first phase where eggs are being produced, and the second phase where now you have ovulated and now you're either going into pregnancy or menstruation. Yeah. This first phase of the cycle where the body is producing the egg is highly unpredictable, and it depends on environmental factors, depends on the stress. So that app mainly tells us, it gives us, it say, okay, day 30, I'm going to have my period, or day 28. But this time, and it always assumes that everyone ovulates on day 14. Yeah. It's like having a bus on the bus stop. I know after 5 minutes, it's going to stop here. Yeah. Then it's going to stop here. But there's no camera inside the ovary, inside the vault, that is going to tell you at what point Elena is going to step out of the bus so that it can continue. Okay. That's what I'm talking about. So it is highly unpredictable. Sperms take 5 days. Okay, our fertile window is around 5 days before ovulation and that other day. Because sperms spend 5 days in the vagina or in the reproductive system, but ovulation we have only 24 hours. Okay. Yeah. So we have to be timed. Yes.
The thing for the app, because like sometimes it works and you find that when the days are done, you get your periods. Like how
that is exactly what I'm talking about. It's very good at informing you when you're going to get your period. Okay. This second phase, what we call the luteal phase, is standard. Okay. It will work on the history of your previous periods to say, okay, now after 28 days, the period will come. But remember, most apps have those dotted lines in the middle that show you when you're ovulating. But that is what we are talking about, because we're talking about conception and fertility. Okay? So now when you look at that middle part, it is highly unpredictable. Yeah. Yes. So mainly you have to rely on, you may follow it, but rely on the symptoms that your gynecologist has talked to you about.
Okay, so doctor, there is also something like, why do you think some couples conceive easily in their 40s while others are still struggling in their 20s?
Well, I must say there are exceptions to the rule. Okay. In everything, there's an exception to the rule. And there are others who are struggling in their 20s and others find it easy to conceive in their 40s. But also, people don't tell us how they conceive. Okay. Yeah. I'm not going to say that they all go for IUI or IVF. Others may conceive naturally. Okay. And then secondly is because we have a lot of premature ovarian failure. We are seeing young girls who are not having a good ovarian reserve, okay? So their ovaries are failing at an early stage, at early years, due to many causes. Yeah, sure. So abroad, in the Western world, they have things like maybe smoking or other things, but even here, when we come back here in Uganda, what are those things that we see that cause premature ovarian failure? Okay. The nutrition, the lifestyle, the medication, PID, infections. Yeah. So there is quite a lot. And then the other one, like I said, there are exceptions to the rule. Others will conceive, but others will not tell you. Okay, and those are confidential things that we have in the fertility clinics. Okay. Yeah.
Also, doctor, is fertility only about age, or there are other hidden factors apart from lifestyle you talked about? People should know about today.
Okay, so when we talk about a fertility clock, the number one predictor, like I said, that we cannot beat is age. Okay. That does not mean that I am now 40. My eggs are out and my story has ended. Okay. Because I mean, there are so many ways that you can have a baby, and this is just to give hope to those who think, oh well, I'm old now, and you know. So apart from age, there are medical conditions that can really disturb the way you conceive. I'll give an example: polycystic ovarian syndrome, the one that is currently called PMO. Okay, so you will delay to ovulate. There's a problem with the communication of the signal. By the time the signal comes, there's science there that we cannot get into. By the time the ovary reads the signal, we have missed several days, and then by the time we get a period, the ovulation is not really in sync with. So we have disease conditions like polycystic ovarian syndrome. We have even diabetes. We have to have hypertension. Other people on drugs, chemotherapy. So it's mainly drugs, age, but the number one is age. And
how about contraceptives? Using contraceptives?
That's a difficult question, and it has very many contextual issues around it. Now, I want to be very honest with you and for the viewers, this is a view that is out of experience. Say you can go and read. The reason why there are women who will have, say, like one injection, of contraception, that it may take them another 3 or 4 years to conceive, and they've had one. The others who will have 1 year or several of them, and as soon as they stop, they will conceive. So it's all about counseling what kind of body you have. It's not that, oh, maybe Jovia has used this, so I have to use it. It worked well for her, but there are risk factors that are related in contraception methods that will predispose you to either primary infertility or secondary infertility. So when you come to the clinic, you have to go into all those questions with your guide and the counseling, so that we choose the method that is best suited for you.
So if someone delays having children, can they like restore their fertility later?
So if they have delayed having children, yet this again, how do you define delay? What is your definition of delay? Is it
above 40 years? Because you said 40.
We are declining in quality of the egg at 40 and yes, going to 45. So if they are around that time, how they can reverse? So this is again an interesting question, because there are so many supplements on the market,
and also fertility treatments. There are many nowadays. Like are people just being misled, or it's something that works?
So we have, let's start with the supplements. There are so many, CQ10, Mayo, all those things are there. They help to support other functions and systems in the body, plus ovarian function. However, you will not take your supplements out of age. Because remember, we are looking at quality. We are looking at quality. There is wear and tear. So age is still an important factor here. But like I said, that does not mean that that's the end of your story. There are other methods that we can use. There are methods that we can use to stimulate the ovaries. There are medications on the market. And then there are other assisted reproductive techniques, IVF, there is intrauterine insemination. There are quite a number of things that one can use. But then it also depends still on the age. There are people who've had 8 cycles of IVF and have not been able to achieve a pregnancy.
Because you find that some people will be like, we tried everything, but still we failed.
And that is what I tell my friends, that please listen to your body. Once you have such kinds of incidences, fertility is a marker. Your cycle is a clue to your overall health. And that is what we have discovered. You have polycystic ovarian syndrome. Be aware, you are prone to type 2 diabetes, you're prone to cardiac disease, you're prone to other conditions that probably are deep-seated. They are stopping you from conception, but you don't know. And you keep trying and trying. People who have endometriosis, take for instance, the quality of the egg has already been tampered with, so it cannot be the same.
Also, doctor, there is something you talked about, those types of diseases that the conditions that can lead to infertility, but we also have an issue where nowadays people talk about infections, untreated infections affecting someone's chances of having children. What's your take on that?
So I'll start with the male. Once the semen, once the sperms are infected, it will be difficult to achieve to make someone pregnant, to achieve a conception as a couple. That's for the male. Now for the female, It's similar because the structure. And there are things, for example, an intrauterine device. So there are things that facilitate infection to go through all the way. Because when we are talking about fertility, we talk about the structure, the integrity of the structure that is responsible to carry the baby, and then also the integrity of the structure that's responsible to manufacture, that is the sperm and the egg. And then we talk about the which I consider intrinsic, those are the hormones, the signals. Okay, so it is not a one thing, get pregnant, the baby is there. When you talk about infections, we are dealing with the integrity of the structure. When infections have gone through, they can block the endometrium, they can block the tubes, they can do anything in the reproductive area, and it will be difficult for that sperm to travel, also for the egg to come so that they can meet. Yes. Also, Dr.
Before we wind up, let's talk about lifestyle and protecting fertility. What are some of the daily habits people can do to protect themselves and their immunity? And also, there is an issue that comes with, people talk about it so much, stress affecting conceiving. So I think you can wrap it all around there and you see.
Okay, lifestyle per se is good. When we talk about general living, but lifestyle will not make you 5 years younger. When we are talking about fertility, you will look fine, you will be strong enough, you will have all the energy, but the ovary and the egg and the sperm, we are dealing with miniature, creatures, very small, which age, so it's okay to have a good lifestyle because it gives you it gives you a good feeling, but you will do sports, you will take all those things, but that is why we're talking about the fertility clock.
You do everything, important, but then
and there are tests that we do. There are tests that we do to measure the quality and the quantity of the eggs. So we have tests like anti-Mullerian hormone, which are produced by the egg itself. So those are tests that we do to find out whether you still have a good ovarian reserve. So you may be beautiful, but then and you may be very sportive, but then your reserve is not really giving you mileage in conception. Yes.
Also, stress, can it prevent someone from conceiving?
Yes.
Yes,
you can.
Also, what role does body weight play in fertility?
A very big role. A very big role. It can actually stop you from conceiving. But remember, I said there are exceptions to the rule.
Also, before we end, is there any certain myth you would like to correct today about fertility clock?
Maybe having regular periods does not mean you are ovulating. That's very important for our women to know, and the men. If your periods are regular, doesn't mean that you're ovulating, and that doesn't mean that you can just get pregnant.
Also, what biggest mistake people actually make about their fertility?
Mistakes in fertility I must say are all small and are all big, because mostly are driven by myths. Myths and conversations that people are having. So one is going to come and say, well, the other one took maybe clomiphene and she was able to conceive. Then another one will say, I will take clomiphene, but the integrity of the structure, the tubes are blocked. So you're stimulating, but there is no passage. So I think the mistake is to copy what is happening to others. This one uses this family planning method, so it should be good for me. So copying what others are doing. So our bodies are unique. Every woman is unique. And in our clinic, we don't handle a sickness. We don't handle your condition. We handle a woman as a unique creature, because you have your own story, and your story surely has not ended. There's a lot of hope.
So also, these ones I think we shall require very short answers because we are running out of time. When should a couple stop waiting and visit a fertility specialist?
It's interesting. When should a couple stop?
Stop waiting. Actually, that's it. When should a couple stop waiting to visit a facility that handles fertility?
I don't have a one sentence answer to that.
Okay, it's okay.
Because even at 60,
okay,
a man can still make a woman pregnant because we have artificial methods.
Yeah. Okay, so what message do you have for young people who are not ready for children but want to protect their future fertility?
One thing I can say is to understand that age does not wait. Okay. Keep healthy. And take care of your reproductive. Avoid infections. Okay. Use protection where you must. Use family planning methods with caution. Don't just pick. Yes, and always check in with your gynae for screening, STDs. Get the right treatment. Okay, so also for someone who is watching today who has been struggling to conceive, what hope and advice would you give to them? Well, our friends who are the couples who are struggling, like I said, even males, the couples who are struggling, there is hope. Okay. There is hope. There are so many reproductive technologies that are on ground that we cannot go into at this point. Yeah, sure. Yeah, there are quite many. There is hope. Please come and reach out to us, and then we can advise you on the best way. There is hope. I don't want anyone to give up on this journey. Okay. Because everyone's journey is unique and it is never complete. Okay. Yes. Okay, so doctor, as we are winding up, what's your last take about fertility clock? As a general thing. Generally about fertility clock, I think is what I said. Age will not wait. Okay. Yes. Okay, and then that brings us to the end of your health discussion today. Thank you very much, Dr. Eleanor Nachintu, for your expertise. And as we are winding up, before I forget, someone may want to talk to a specialist about this. Maybe if you could leave for them your phone number to contact you on more details, and also send greetings to one or two people who are watching you today. Yeah, as we wind up. Okay. Yeah. So for those who wish to contact us at Midland Healthcare, the number is 0783 39 70 30. 0783 39 70 30. And I want to send greetings to all the staff at Midland Healthcare because I know they are watching and this is what they do best, to get all the information. Thank you very much for the good work, and all our viewers at TV1. Yeah, thank you very much for being around. Okay. Yes. Thank you very much, Doctor. So today, our dear viewers, we've learned about fertility clock and taking care of your reproductive health, plus seeking medical advice early can actually make a very big difference for you. A special thanks to Dr. Eleanor Nachintu for sharing that knowledge with us today. Remember, your fertility is a health conversation, not a topic of shame. Take care of your health and seek the right information. And remember, your health matters. Let's meet again tomorrow. Have a blessed day.